As a result of severe sorrow and grief, the feeling of badness and discomfort is another issue and should not be labeled as depression. However, the specific symptoms of depression, which manifest in different areas of life, when present to a clearly defined extent, take us to a point where we can call and recognize our struggle as depression. We know that in the United States, the main and fundamental problem people face is the use of drugs, alcohol, and cigarettes, with about 17% of people being affected by them at any given time. We also know that issues of anxiety, worry, panic, and fear preoccupy and trouble 12 to 13% of people at any time, causing harm and danger. Yet, despite depression affecting 8 to 9% of people, with about 5% experiencing severe depression or depression that is clinically diagnosed, and around 3% suffering from mild and chronic depression, about 1% of people suffer from a condition involving both depression and mania, known as bipolar disorder or manic depression. In this condition, the person, while experiencing depression, also experiences mania and euphoria, finding themselves sometimes in a valley and other times on a peak, rarely traveling on an even road. But despite the fact that this problem and illness affects 8 to 9% of the population in the United States at any given time, due to the greater harm caused by drugs and anxiety, depression plays the largest role in disabling people and preventing them from performing their normal daily activities. This impact is so significant that about 10% of disabilities or incapacitations that hinder individuals from normal activities are due to depression. Therefore, even though depression affects a smaller percentage of the population, it has a more significant negative impact. We also know that the leading cause of suicide is depression, with about 70 to 80% of people committing suicide due to depression, far surpassing the influence of other issues like drug abuse, especially alcohol, or other mental illnesses such as schizophrenia, which contribute to suicide at rates of only 10 to 20%. Unfortunately, more than one-third of people struggling with anxiety or depression do not seek help from specialists. Only about 30 to 33% of people seek professional help when dealing with depression and anxiety, and half of these individuals abandon treatment halfway through. Thus, while people seek help for these problems at a low rate, unfortunately, even that small percentage does not see the treatment through to the end. As a result, they continue to struggle with the illness, with the likelihood of its recurrence. We also know that the rate of depression among girls, and especially women, is 2 to 3 times higher than among boys and men. However, when it comes to mania and euphoria, or what is known as bipolar disorder, there is little difference between men and women. Many believe that the higher rates among women are due to the data collected from those who seek professional help. However, other studies emphasize that at least depression is twice as common among women as it is among men. Fortunately, women tend to recognize the illness earlier, seek treatment, and generally contribute more to their recovery than men. Additionally, due to the discussions they often have about their issues and problems, they create conditions that likely reduce the recurrence of the illness under normal circumstances. However, due to hormonal differences, as well as the psychological or stress-related pressures that modern life imposes on women more than men, along with the more challenging childhood, adolescence, and youth that girls experience in most societies, and the fact that their rights are often overlooked in many aspects of life, subjected to discrimination and a form of oppression more than men in both family and social environments. All these factors combine to make this illness more prevalent among them. Contrary to popular belief, this issue is more common among young people and adults than among the elderly. Although old age brings with it certain symptoms of depression, most cases are related to decreased energy levels and age-related conditions rather than depression itself.